Hello, I'm Lelda Smits for the Finance News Network, and joining me from LifeHealthcare Group is its Managing Director and CEO, Daren McKennay, and Chief Operating Officer, Matt Muscio. Daren, Matt, welcome to FNN.
Yeah, thanks for having me.
Good to be here.
Daren, LifeHealthcare Group is an independent distributor of high-end medical devices, and you've just tied up the acquisition of M4 Healthcare. How does the acquisition fit into the company's overall growth strategy?
So the acquisition is consistent with our overall growth strategy that we communicated both at time of IPO and then later in market updates, where we talked about both organic and acquisitional growth. And this fits within the extension of our existing cardiac ultrasound business to extend that into the important point of care market.
Okay, and Daren, what are the terms of the transaction?
Yeah, so it was an unconditional agreement between us and M4 that completed on the 27th of May. The acquisition price was $9 million with a small, modest earnout of $600,000, which is based on the first 12 months' performance of the business.
Certainly. So how soon will the M4 Healthcare asset be integrated into LifeHealthcare?
Yeah, so because of the familiarity with the market and the segment, because it is ultrasound, it's similar to our existing ultrasound business, we think there'll be a fairly rapid integration to the business. Albeit this is a separate market, so we'll be running the sales teams and the business separately. The integration will be fairly straightforward and low risk.
Thank you, Daren. And Matt, what has attracted you to M4 and the point of care market segment?
The exciting aspect about point of care ultrasound are the number of patients who can benefit from the evolution of ultrasound technology into smaller, more mobile units with higher imaging quality. And M4 have brought focus to this opportunity, built a really compelling portfolio for not only traditional users of point of care ultrasound with anaesthetists, emergency departments and intensive careists, but also to emerging markets with specialists in regional medicine.
Okay, and Matt, what is the size of the point of care market and what factors are fueling its growth?
Estimates have the point of care ultrasound market at 40 million with mid-single digit growth, and that's really being driven by the recognised benefits that this technology brings to standard of care, improved patient outcomes and efficiencies in the hospital setting. Beyond that, a range of subspecialties that are taking up point of care ultrasound, including urology, obstetrics, day procedures such as venous procedures for phlebology. These clinicians are recognising the benefits that point of care ultrasound can bring to their practice and to regional medicine where they may not have immediate access to sonography.
Now, acquisition is clearly a part of your growth strategy, as mentioned before. What are the key growth opportunities you see in the point of care market?
Look, M4 is a great fit for LifeHealthcare. It goes without saying that we need to work with our suppliers to stay at the forefront of point of care ultrasound technology. But beyond that, our growth will be driven off using the full breadth of our ultrasound combined with our cardiac business to strengthen the position of the hospital market. But beyond that, to identify and educate subspecialists and regional practitioners in the benefits that point of care ultrasound could bring to their patients in both diagnostic and therapeutic areas.
Thank you, Matt. And finally, Daren, how will LifeHealthcare Group pay for the acquisition and when do you expect it to become earnings per share accretive?
So the acquisition will be 100% debt funded from our existing debt facilities, which will take our gearing ratio to about 1.5 times. That'll give us additional headroom in our existing facilities for further acquisitions, but fully funds this acquisition. As a result, and because of the purchase price of the acquisition, we expect it to be EPS accretive from day one, and obviously we're looking forward to growth opportunities to continue that into FY16.
Thank you, Daren and Matt, for the update from LifeHealthcare Group.
Thank you.
Great, thank you.